Each year, thousands of new physicians graduate with an average of $195,000 in debt each. And the question I wanted to answer in writing this essay and talking to people was not whether this was a good investment, because multiple studies have shown that it is a good investment. What I wanted to find out was where all of that money goes and how it's spent. And it turns out that no one really bothers to sort out where it goes. I really enjoyed going to NYU to meet Dr. Robert Grossman, who since 2007 has been the Dean CEO of the Langone Health System. And the reason I went is I wanted to understand where medical student tuition went. And we decided that the NYU medical students were paying around $25 million a year in tuition. And first of all, on the overall budget of $10 billion, that's less than 1%. And also, Dr. Grossman, because of this large IT system that he had built, could track where that money was going. And he could tell that it was not going to the resources or faculty that were teaching those medical students. In fact, the vast majority of it was going to support what he called unproductive faculty, tenured professors who no longer bothered to write grants or had any clinical responsibilities. So the question is whether or not medical schools should understand the marginal cost of educating one medical student. And I feel that absolutely yes, they should. Not only would this be a good business practice for them to understand where their money was coming from and where it was going, but the medical students themselves, if they had access to this information, could then make a more informed decision. For instance, a college kid who wanted to go to medical school could look at all of the medical schools out there and see what the marginal cost was of educating that medical student and how much they were charging in tuition and make a decision on where to go. I wager this would decrease the price of tuition because then the average consumer would have more information about where to go. When I learned that the amount of money we paid in tuition was only a rounding error in the school's overall budget, and in fact didn't even support the educational experience, or the vast majority of it didn't support the educational experience, this was very frustrating. Because not only is there the principal, which is the amount of money that we pay for those actual tuition dollars, then there's the amount of interest, then there's the opportunity cost, and then there's the stress and how that amount of debt guides your decision. And so this isn't just for my wife and I, this is for every medical student in the US who pays a lot of money in tuition. And I wager that the same principles are happening at all levels of education, whether law school or graduate school of any sort, and even at the undergraduate level. We ought to be able to know where our tuition dollars are going and what we're buying with our money.